Can you talk about the 5-year benchmarks? We all out in the public hear a lot, if you go for 5 years after you're done with your cancer treatment, it's all gone. And I think that's really confusing for a lot of people.
I think it's a disservice, and it's kind of an arbitrary endpoint. And again, a lot of it goes back to when we do clinical trials and you're trying to show when treatment works. One of the benchmarks has been how many patients are alive or disease-free at 5 years. And it's, 5 years, there's nothing magical about 5 versus 4.5 versus 6, but it's sort of stuck. I think some of it came from our recommendations for tamoxifen are taken for 5 years. So there's some, you would make sense that if you're taking it for 5 years and we have 5 years of benchmark, it means that nothing can happen after 5 years. It's very false. And so unfortunately with many types of cancer, it can still come back after 5 years. I think every day matters, right? So whether it's been 4 years or 6 years, if there's no cancer recurrence, that's great. But it is a bit of a disservice. I have so many patients who say, oh, it's going to be 5 years. That means I don't have to come back anymore because the cancer can't come back, which is just not true. Some cancers, and again, very aggressive leukemias, if it's been 2 years, it may not ever come back. And so somewhat is disease dependent, but I think, and again, I see this all the time, you got people who it's been 8, 9, 10, 12 years and you think you're totally in the clear and it can still come back.